Filming?
I'm filming. Room number 8.
Oh, 9.
This is number 8, right? It's a lovely room. This is where they told me I had cancer.
In this room?
Hate this room. Anyway.
Don't stop drinking.
That's the big dog.
Hello.
Fresh from Africa.
You jealous?
Dr. DeSancho, and she informed me from abroad that she wants to check your von Willebrand's panel. So we draw that today too.
Okay.
Okay, just to see if von Willebrand's protein is doing.
For some reason, it's going back to normal.
Well, I don't... wait, how do you know that?
Because it was 37 the last time, and it's usually under 6, my factor 8.
Oh, right, but last time you were also really stressed out. So, we'll see what it is this time. Like we told you, it goes up in the times of stress, either physical or psychological, actually. So, how's your energy level?
It's fine. I mean, it's not 100%, obviously.
Right. How's the nausea that you were having before?
It comes and goes. Like, for example, today, I felt for a little while like I was going to puke.
Mm-hmm.
But I didn't take that nausea. I'm trying to gauge it.
Mm-hmm.
Like, if I really felt like I was going to throw up,
mm-hmm.
I would take that nausea med.
Mm-hmm.
But I'm trying to, like, see just how much I can take and how much I can't take. You know what I mean?
Okay.
But it comes and goes. I don't ever, for the record, I don't ever feel good on these meds. I don't ever feel great.
Mm-hmm.
Like, I don't really eat much. Mm-hmm. I've been losing some weight, which is good, a good thing. But I can't drink for the life of me. Like, if I wanted to have a couple glasses of wine, I can't even stomach it.
That's not right by me.
Well, yeah, me too. But.
So, just so you know, I don't ever feel great.
Well, it's not expected for you to feel great. So this is induction therapy. So induction therapy is powerful therapy to reduce your disease as much as possible prior to your stem cell transplant. Okay?
Yeah. So wait, so tell me about the stem cell business, because you haven't never talked about this before.
So the best therapy for multiple myeloma that there is something called an autologous stem cell transplant. And you shouldn't really consider it a transplant because you're not getting cells from somebody else. They're your own cells. So basically, when we get your disease down to a level where it's barely detectable or not detectable in your body anymore, we then give you a very high-dose chemotherapy such that it would wipe out your bone marrow and hopefully a lot of the myeloma that is there in your bone marrow too. You would die normally in that situation, but you do not die. In fact, less than 1% of the people who do this die because we give their stem cells back to them after the chemotherapy has been given. Therefore, these stem cells go into the empty bone marrow, repopulate it, and when you're done, you have a bone marrow that is essentially myeloma-free, and you can be off all pills and off of therapy for a while. Okay?
How long's a while?
Average for the average length of remission after a bone marrow transplant like that is 1 year, but it goes, 3 years, 5 years. We've seen 10 years. Really depends. The reason why it's average is that there's some people who don't have a good disease reduction with their initial induction therapy. They go through the transplant anyway, and it comes back right away. So, in order to make sure that you have a nice long remission with the transplant, we give you extremely hard, toxic therapy right now. So this is sort of like putting money in your 401k. It hurts you now, but in the end, you'll be happy that you did it. Okay?
Okay, but, so this, stem cell transplant business, we haven't talked about that before.
It's 6 months from now.
At least.
Mm-hmm. At least 6 months.
But what happens if, is that necessary?
No. Some people tolerate these drugs very well, and then, we'll start reducing the doses of them, some things like we've already done for you with the Biaxin. Some people say, look, I'm in complete remission on these pills. I don't mind being on these pills. I'll just continue taking them. I don't want the transplant. And that's fine. But we'll still recommend that you freeze some of your cells and put them in the refrigerator. So if you get into trouble in the future, you can always fall back on that.
Right. So we'll talk about that when we get there.
Mm-hmm.
What are we going to find out today?
We're repeating your myeloma labs. So we're going to find out whether these pills that you're taking are working. We're doing the labs for Dr. Hartle, and we're doing the labs for your von Willebrand factor.
And from the CBC, are we going to learn anything at all in the next half hour?
Well, all we're really going to learn is if the Revlimid is too toxic for your bone marrow, needs to be dose adjusted. So we can probably find that out right now.
Cool.